Another day, another story. Management of hypertension. The management of hypertension typically involves a combination of lifestyle modifications and medication. The goals of treatment are to reduce blood pressure levels, prevent or manage complications, and improve overall health outcomes. Lifestyle modifications that can help manage hypertension include weight loss. Maintaining a healthy weight can help reduce blood pressure levels and lower the risk of developing complications. Regular exercise. Regular physical activity, such as brisk walking, swimming, or cycling, can help lower blood pressure levels, improve heart health, and reduce the risk of complications. Healthy diet. A diet rich in fruits, vegetables, whole grains, and low-fat dairy products, and low in saturated and trans fats, can help lower blood pressure levels and improve overall health. Limiting alcohol intake. Drinking alcohol in moderation or avoiding it altogether can help lower blood pressure levels and reduce the risk of complications. Quitting smoking. Smoking can damage blood vessels and increase the risk of complications. So quitting smoking is an important part of hypertension management. Medications that are commonly used to manage hypertension include angiotensin-converting enzyme, ACE, inhibitors. These medications work by relaxing blood vessels, reducing blood pressure levels, and improving blood flow. Angiotensin receptor blockers, ARBs. These medications also work by relaxing blood vessels, reducing blood pressure levels, and improving blood flow. Calcium channel blockers. These medications work by relaxing blood vessels, reducing blood pressure levels, and improving blood flow. Diuretics. These medications help the kidneys eliminate excess salt and water from the body, reducing blood pressure levels. Beta blockers. These medications work by slowing down the heart rate and reducing the force of the heart's contractions, reducing blood pressure levels. The choice of medication depends on various factors, such as the severity of hypertension, age, underlying health conditions, and potential side effects. Therefore, it is important to consult a healthcare professional to determine the most appropriate medication and dose for individual cases. Overall, managing hypertension requires a comprehensive approach that involves a combination of lifestyle modifications and medication, as well as regular monitoring and follow-up with a healthcare professional to ensure effective control and prevention of complications. Treatment of resistant hypertension. Here are some approaches that may be used to treat resistant hypertension. Identifying and addressing underlying causes. This may involve investigating and treating underlying medical conditions that may be contributing to hypertension, such as sleep apnea, kidney disease, or hormonal disorders. Medication adjustments. This may involve adjusting medication regimens, adding or changing medications, or using higher doses of existing medications. In some cases, combination medications that contain 2 or more antihypertensive agents may be used. Lifestyle modifications. This may involve making changes to diet, increasing physical activity, reducing salt intake, limiting alcohol consumption, and managing stress. Renal artery stenting. In rare cases, resistant hypertension may be caused by narrowing of the renal arteries, which supply blood to the kidneys. In these cases, renal artery stenting may be performed to improve blood flow to the kidneys and lower blood pressure. Referral to a hypertension specialist. In cases where hypertension is particularly difficult to control, referral to a hypertension specialist may be recommended. Hypertension specialists have expertise in managing complex cases of hypertension and may use specialized diagnostic tests and treatments, such as ambulatory blood pressure monitoring or renal denervation, to help manage the condition. It is important to work closely with a healthcare professional to determine the most appropriate treatment approach for resistant hypertension, as well as to monitor blood pressure and adjust treatment as needed to ensure effective control of hypertension and prevention of complications. Treatment of hypertensive emergencies. Treatment of hypertensive emergencies involves rapidly lowering blood pressure to prevent complications. Here are some approaches that may be used to treat hypertensive emergencies. Hospitalization. Patients with hypertensive emergencies require immediate hospitalization for close monitoring and treatment. Medications. Intravenous medications are typically used to rapidly lower blood pressure in hypertensive emergencies. These may include nitroglycerin, nitroprusside, labetalol, nicardipine, or clozapine. Monitoring. Patients with hypertensive emergencies require frequent monitoring of blood pressure, heart rate, and other vital signs to ensure that blood pressure is lowered appropriately and to monitor for complications. Treatment of complications. Hypertensive emergencies may be associated with complications such as acute heart failure, pulmonary edema, or acute kidney injury. Treatment of these complications may involve additional medications, such as diuretics, or other interventions such as oxygen therapy or dialysis. It is important to seek immediate medical attention if you experience symptoms of a hypertensive emergency, as rapid treatment can help prevent or limit organ damage. Treatment of hypertensive emergencies should be managed by a healthcare professional with expertise in the management of acute hypertensive crises. Thanks for watching.